Welcome to Dr. Ravichandra Official. Please like, share, and subscribe Dr. Ravichandra Official for more interesting topics and videos on pathology. Let's start the video. Tissue composed of macrophages, capillaries, and fibroblasts is called as granulation tissue. All the following are features of apoptosis except cell swelling, chromatin condensation, formation of cytoplasmic plaques, lack of inflammation, phagocytosis of apoptotic bodies. It is cell swelling. Remaining are the features of apoptosis or apoptosis, but cell swelling is not the feature of apoptosis. Dystrophic calcification is formed only in coagulative necrosis, does not occur on heart valves, rarely causes dysfunction, is rarely found on mitochondria, is formed by crystalline calcium phosphate mineral. Dystrophic calcification is seen in dead tissues and decaying tissues. It is formed by crystalline calcium phosphate material or mineral. So the answer is E. Irreversible cell injury is characterized by dispersion of ribosomes, cell swelling, nuclear chromatin dumping, lysosomal rupture, cell membrane defects. Irreversible cell injury is characterized by cell membrane defects. Metaplasia can be caused by vitamin B12 deficiency, preserves mucus secretion in the respiratory tract, is typically an irreversible process, is a process that occurs in Barrett's esophagitis or Barrett's esophagus, is an increase in the number and size of the cells in a tissue. Answer is metaplasia is a process that will occur in Barrett's esophagus. In cigarette smoking, columnar epithelium is converted to squamous epithelium, whereas in Barrett's esophagus, squamous epithelium is converted to columnar epithelium. In acute inflammation, which event occurs first? Arteriolar dilatation, arteriolar constriction, edema, leukocyte migration, blood flow, stasis. The answer is, it is first constriction, then dilatation. So, answer is arteriolar constriction is the first event in acute inflammation. The first vascular response to injury is slowing of the circulation, venular dilatation, recruitment of vascular beds, capillary engorgement, or arteriolar vasoconstriction. The answer is, as I said earlier, it is arteriolar vasoconstriction. Chronic inflammation is always preceded by acute inflammation, characterized by hyperemia, edema, and leukocyte infiltration. Most frequently results in resolution. The factors underlying monocyte infiltration are the same as for acute inflammation. Chronic inflammation is the factors underlying monocyte infiltration, just like the same as that for acute inflammation, is the right answer. Macrophages may secrete histamine, serotonin, prostaglandins, oxygen-free radicals. The answer is oxygen-free radicals. Dysplasia is a feature of mesenchymal cells, inevitably progresses to cancer, is characterized by cellular pleomorphism. It is same as carcinoma in situ. It is not associated with architectural abnormalities. Dysplasia is characterized by cellular pleomorphism. Metastatic calcification occurs in old lymph nodes, gastric mucosa, atherosclerotic valves, damaged heart valves. Metastatic calcification is seen in gastric mucosa. Macrophages are derived from monocytes, T cells, B cells, eosinophils, plasma cells. It is monocytes. In the blood, they are called as monocytes. When they enter the tissues, they are called as macrophages. White infarcts occur in small intestine, esophagus, lung, kidney, and sigmoid colon. The correct answer is kidney. White infarcts will occur in kidney. Regarding edema, infection does not cause pulmonary edema. Hereditary angioneurotic edema will involve skin only. Facial edema is a prominent component of anasarca. Hepatitis cirrhosis is the most common cause of hypoproteinemia. Hypoproteinemia is the most common cause of systemic edema. The answer is C. Facial edema is a prominent component of anasarca. Facial puffiness, which occurs first in fracture healing. Neutrophil invasion, procallus formation, woven bone ossification, lamellar bone ossification, collagen deposition. It is neutrophil invasion that occurs first in the fracture healing. With regard to embolism, arterial emboli most often lodge in the viscera. Pulmonary emboli are rarely multiple. Amniotic fluid emboli are associated with highest mortality. All emboli consist of either gas or solid intravascular mass. Most pulmonary emboli will produce signs of respiratory distress. Amniotic fluid emboli are associated with the highest mortality is the concern. All the following are type 1 hypersensitivity reactions, primary mast cell mediators, except histamine, tryptase, heparin, platelet activating factor, eosinophil, chemotactic factor. Answer is platelet activating factor. Except the platelet activating factor, all the other are type 1 hypersensitivity mast cell mediators primary. Type 2 hypersensitivity involves the cell-mediated immune response, explains the tuberculin skin test, involves the IgE and mast cells, explains many transfusion reactions, includes serum sickness as an example. Type 2 hypersensitivity reaction explains many transfusion reactions. The following are the opportunistic AIDS infections except PCP, atypical mycobacterium, CMV, cytomegalovirus, Mycoplasma pneumonia. The answer is Mycoplasma pneumonia. Which of the following is an antioxidant? Vitamin D, vitamin B12, vitamin E, vitamin K, vitamin B6. The answer is vitamin E. Vitamin E is an antioxidant. Which deficiency will cause diarrhea, dermatitis, and dementia? DDD is seen in niacin deficiency. Diarrhea, dermatitis, and dementia are seen in niacin deficiency. MHC, major histocompatibility complex class 1 are present on all except platelets, nucleated cells, RBCs, WBCs. The answer is RBCs. Except the RBCs, MHC class 1 are present on all cells, nucleated cells, platelets, and WBCs. As RBC are non-nucleated, they are not seen in RBCs. HLA-B27 is not seen in which of the following? Ankylosing spondylitis, Ritter syndrome, rheumatoid arthritis, psoriatic arthritis. Answer is rheumatoid arthritis. HLA-B27 is seen in ankylosing spondylitis, Ritter syndrome, and psoriatic arthritis, but it is not seen in rheumatoid arthritis. The role played by the major histocompatibility complex 1 and 2. It will transduce the signals to T cells following antigen recognition, mediate the immunogenic class switching, presents antigens for recognition by T cell antigen receptors, enhance the secretion of cytokines. The correct answer is the role played by the major histocompatibility complex 1 and 2 will be presents antigens for the recognition by T cell antigen receptors. Antigen presented along with HLA class 2 will stimulate CD8 cells, CD4 cells, CD2 cells, CD19 cells. Antigen presenting along with HLA class 2 will stimulate CD4 cells. 2418, remember in that. Major histocompatibility complex class 1 is seen on which of the following cell? Macrophages only, all body cells, B cells, all blood cells except erythrocytes. Answer is all blood cells except erythrocytes. Endotoxic shock is initiated by peripheral vasodilatation, injury to endothelial cells, inadequate blood volume, failure of the myocardial pump. The answer is injury to the endothelial cells will cause endotoxic shock. Nephrotic syndrome causes are all of except general edema, hematuria, hyperlipidemia, hypercholesterolemia. The answer is hematuria. There will be generalized edema, hyperlipidemia, hypercholesterolemia in nephrotic syndrome. There will not be any hematuria. Hematuria is seen in nephritic syndrome. If father is hemophiliac and mother is normal, which of the following will be affected? 50% of the sons will be affected, 50% of the daughters are carriers, all daughters are carriers, and all sons are carriers. The answer is all daughters are carriers. Septic shock may cause all the following except myocardial depression, DIC, ARF, ARDS. DIC is disseminated intravascular coagulation, ARF is acute renal failure, ARDS is acute respiratory distress syndrome. Septic shock may cause DIC, ARF, and ARDS, but not myocardial depression. Thank you for patient listening. Please like, share, and subscribe Dr. Ravichandra Official for more interesting topics and videos on pathology.